TV, online and on your smartphone. This is Ticker News.
Right now, this is Ticker News Insight.
Hello and welcome back to Ticker News Insight. I'm Benay Ozdemir. Now, MediGrowth is an Australian company that distributes pharmaceutical-grade, Australian-made medical cannabis oils. Now, that's utilising locally grown dried cannabis flower. Well, they recently launched a telehealth service called HeyQ Health, and they've announced plans to construct the MediGrowth Centre for Excellence in Geelong, a purpose-built research, manufacturing and genetics hub. Well, let's bring in Adam Guskic from MediGrowth. Thank you so much for your time. Firstly, let's dive straight into it. Medical cannabis is legal in Australia, but still, it's highly regulated. So how does MediGrowth's business model work?
You're right, Benay. It is a very highly regulated industry here in Australia, and MediGrowth is fully licensed for all of our operations. Really, our business model is across two core pillars. We have a revenue generating arm where we're supplying Australian grown and Australian made products to Aussie patients via our own distribution channels. We have a warehouse and a distribution centre here in Melbourne. We have some very good partnerships with third-party distribution partners, and equally HeyQ Health, as you mentioned, our digital telehealth platform that allows patients to access very qualified authorised prescribers 365 days a year. The second element to our business model is really the research and R&D arm, and we're very actively involved in those parts of the business, including a current paediatric autism trial looking at CBD in 5 to 12-year-old children for our MediGrowth CBD products. So a lot of exciting R&D projects active and in development as well.
Very exciting projects coming up. Now, how are you providing patients with the products, or do you work with pharmacies to distribute the product? Can you go through that process for people that may not know?
Sure. Basically, the access channels for patients here in Australia are that medicinal cannabis can be prescribed via GPs, medical practitioners and nurse practitioners. So patients can really access those resources. And then from a MediGrowth perspective, we're really supplying our products through sales to pharmacies, through those distribution networks, and through the HeyQ Health network on our digital health. So all of those channels will ultimately deliver our products to patients all across the country.
Now, how relevant is clinical data to the work that MediGrowth does, and are you actively involved in those clinical trials that are in Australia?
Very, very important clinical work, and the research and the R&D behind medicinal cannabis is something that we are firm believers in here at MediGrowth. We're finding a lot of feedback from medical professionals that they're seeing incredible therapeutic benefit from medicinal cannabis for many of their patients who are living with chronic health conditions and unresolved medical conditions. But having said that, there is still a lot of research and clinical legitimisation that needs to come with medicinal cannabis as well, and that's really our mission from a MediGrowth perspective, is to support our products with active trials. As I mentioned, the paediatric autism trial, and we do have interest in advanced oncology care, which is a huge issue for many patients that are currently under treatment for cancer and related conditions, and also for mental health. There's a huge opportunity for clinical research in a whole range of different areas. And in fact, there's over 200 conditions that have currently been approved by doctors here in Australia under the TGA guidelines for medicinal cannabis treatments.
Interesting to hear. Now, how relevant is university and government collaboration in your business at the moment, Adam?
Incredibly important. We are firm believers in that collaboration with thought leaders and with global leaders in terms of research and what can be achieved under collaboration. I think it's always very important to analyse from a business perspective who can bring value to an organisation, and from our perspective, very close alignments and relationships and collaborations with places like Deakin University, for example, who we're working with on our clinical trial and observational trials that are in market currently, and a number of other university and training centres through government that again will continue to really add value to the research, and ultimately that can add value to the commercialisation opportunities as well.
What's the future for MediGrowth now?
A very exciting future. We're seeing an incredible ramp up in broad acceptance, awareness, and involvement in medicinal cannabis here in Australia and globally. So for us, it's really a scale-up opportunity where we're looking at hitting the ground running on moving forward on our revenue generation, which is already growing very rapidly. We're at 30-odd% as an average annual revenue growth rate. And for us, the next step is really funding. We're currently actually raising capital through the equity crowdsource funding platform Birchal, and that will allow us to scale up both distribution and our research activities and really take MediGrowth to the next level. So if there's anybody that's interested in having a further look at MediGrowth as a company and the investment opportunities, they can have a close look at our company profile at the birchal.com website and just have a look at MediGrowth, and you'll have all the information at hand there.
Exciting times ahead, Adam. Thank you so much for your time today. That's the program for now. For more, head to our website at tickernews.co. I'll see you soon.